We're now going to talk about the direction of airflow. So when you're breathing, first place the air comes in is via your nose and your mouth, or we refer to this passageway here behind the nose as the nasal cavity. So we have air coming here, and going down this little opening here called the pharynx. The air then travels down. We have our, well, you probably know it as your voice box, but we have another little opening called the larynx. Now from there, it goes down something that most of us have heard of called the windpipe, but as always, we like to call it something slightly different to confuse you guys. This is called the trachea. So the air travels down the trachea. The trachea then splits into these two branches here. Those two branches are called the bronchi. Now bronchi is referring to both of them, so that's plural. Bronchi. If you're talking about just one of the branches, then we call that the bronchus. Now the bronchus and the bronchi, plural, they then divide up into lots of little branches within the lung. Doesn't really look like that actually. Terrible drawing that is. It's like a couple of spiders inside the lungs, but they're basically branches off the bronchi. And then these have little air sacs on the end. These are big air sacs, so you can see them. If I drew the actual size, then you wouldn't be able to see them. So you're making them much bigger. Starting to look like cauliflower or broccoli, but similar to that, I suppose. And these are called alveoli. Alveoli. And your alveoli are really important because they're surrounded in capillaries, which we talked about earlier. And capillaries are responsible for gaseous exchange. So this point here, this is where the oxygen's been taken into the blood and the carbon dioxide's been taken out. So the main role of the lungs is to take oxygen into the body, pass it to the blood, take carbon dioxide out of the blood and exhale it from the body. Now we've also got some muscles involved in the breathing. So we have something called the diaphragm and we have intercostal muscles. And very difficult for me to draw them here really because you've got your ribs and between your ribs, that's where your intercostals are. And they control the size of your chest cavity. So when we breathe in, our diaphragm contracts, it descends, so it goes down. That increases the size of our chest cavity. The air then rushes in. When we breathe out, we relax our diaphragm. That ascends, and then the air gets pushed out. So it's actually your diaphragm and your intercostal muscles that are responsible for your breathing. If somebody says, how do we breathe? We often think, oh, well, the lungs do that. It's actually not the lungs. It's the diaphragm and the intercostals that help us to breathe.